Chapter 1: The Accidental Discoveries of Psychotropic Drugs. Have you ever wondered how the world stumbled upon psychotropic drugs, the chemicals that have the power to alter our very perception of reality? Was it a meticulously planned scientific endeavor or a fortuitous turn of events? Well, you might be surprised to learn that many of the most influential psychotropic drugs were discovered purely by accident. Let's take a trip back to the early 19th century. The year is 1804, and a man named Friedrich Sarturner, a German pharmacist, had just isolated the active ingredient in opium. He named it morphine, after Morpheus, the Greek god of dreams. This marked the beginning of the era of psychotropic drugs. Fast forward to the year 1856. An English chemist, Sir Henry Bessemer, was attempting to find a cure for malaria. Instead, he ended up synthesizing quinine, a compound that would later lead to the discovery of chlorpromazine, the first antipsychotic drug. Chapter 2: The Unintended Discovery of LSD. Now, let's jump to the middle of the 20th century. It's the year 1938, and a Swiss chemist named Albert Hofmann has just synthesized lysergic acid diethylamide, or LSD, while researching blood stimulants. 5 years later, he accidentally ingests some of it and experiences the world's first acid trip. Chapter 3: The Evolution of Psychotropic Drug Use in Psychiatry. In the same decade, a French surgeon named Henri Laborit used chlorpromazine to sedate patients before surgery. He noticed that it not only sedated them but also seemed to disconnect their emotional response to their surroundings. This paved the way for the use of chlorpromazine in psychiatry, marking the dawn of a new era in the treatment of mental illness. Chapter 4: The Continued Accidental Discoveries. In the 60s, the accident-prone nature of psychotropic drug discovery continued. Valium, or diazepam, was discovered by Leo Sternbach while he was trying to develop safer compounds for inducing sleep. Chapter 5: The Importance of Informed Decision-Making. Fast forward to the late 90s. Ritalin, a drug used to treat attention deficit hyperactivity disorder, or ADHD, was discovered when scientists were trying to create a stimulant that would not be addictive or cause euphoria. Isn't it fascinating how these accidental discoveries have shaped the field of psychiatry and the way we perceive and treat mental illness? But here's a question to ponder: with such accidental origins, how much do we really know about these drugs? How can we be sure of their long-term effects on our minds and bodies? And are we merely guinea pigs in an ongoing experiment? It's crucial to remember that while these drugs have had a profound impact on treating mental health conditions, they are not without their side effects and risks. It's essential to make informed decisions and to always consult with a healthcare professional before starting any new medication. Think about it, research it, and make informed decisions about psychotropic drugs. Don't just take them because they're there. Understand what they are, how they work, and what they can do to you. Because an informed decision is always a better decision. Remember, your health is in your hands.